Here's some notes on the secretion of vasopressin during stress responses. Vasopressin is produced in the hypothalamus, specifically in the paraventricular and supraoptic nucleus. It's transported via the hypothalamo-hypophyseal portal tracts, and it's stored in the posterior pituitary's Herring bodies. There are a few triggers for release of vasopressin. The primary trigger is hyperosmolarity. The other triggers are hypovolemia, hypotension, and stressors like surgery, infection, cardiac events, and electroconvulsive therapy. Stress response mechanism is essentially a bunch of inflammatory cytokines and then a bunch of hormones being released. So you have hypothalamic activation that triggers proinflammatory cytokines like IL-1, IL-6, and TNF-α. This upregulates vasopressin synthesis. Vasopressin then works synergistically with CRH, and together they increase POMC secretion from the anterior pituitary, which leads to increased ACTH, beta-endorphins, and α-melanocyte-stimulating hormone. Plasma levels may stay elevated for days, this is for vasopressin, after a stressor ends, and the magnitude and duration of the vasopressin increase correlates with the stress severity. Osmolality threshold is 280 milliosmoles per liter. In septic shock specifically, you have an initial sudden release in vasopressin levels, and it's followed by a rapid depletion. The levels then become too low for hemodynamic maintenance in some severe cases, and there are some possible causes for this. You could be depleting your vasopressin stores, you could have baroreceptor reflex depression, and you can have increased vasopressin metabolism. In this case, you might need to provide additional support to the patient with exogenous vasopressin. There are two big receptor areas. The V1 receptors are on the vascular smooth muscle and cause vasoconstriction. The V2 receptors increase water retention in the distal renal tubule and collecting ducts. So some clinical applications. Again, there are some promising results in septic shock treatment for giving vasopressin and other vasopressors. You have improved outcomes in catecholamine-resistant septic shock, less severe sepsis cases, and in myocardial and renal function improvements.